How can you bypass the MCCQE1 exam and still become a fully licensed doctor in Canada? Let's talk about that. Hi there, I'm Dr. Rajiv Iyer from IMG Secrets.com, bringing with the experience of guiding hundreds of doctors like you. I have work experience both in Canada and the USA, and I presently practice in the USA. Are you someone who is interested in moving to Canada? Just comment a simple yes or no below. Many doctors whom we talk to are really scared of exams like the MCCQE1 and the USMLE exams. I'm going to tell you what path exists so you can transition on becoming a fully licensed doctor in Canada without MCCQE1. But before this, so let's look at what exactly this MCCQE1 examination is. Now this stands for Medical Council of Canada Qualifying Examination Part 1. Canada before had two other exams, just like how USMLE has multiple steps. They had an exam called MCCEE, the evaluating exams, which in my opinion was a ridiculous exam. I have written it and thankfully they got rid of it. There used to be another exam called MCCQE2, which stands for Qualifying Examination Part 2, and they got rid of that and then introduced another OSCE based exam called the NAC, the National Assessment Collaborative. Cool. When you go through your medical college or medical school in your home country, you do a series of exams and then you eventually graduate out of medical school or medical college and then become a doctor. Similarly, in Canada, the local graduates who go through medical school in Canada take this exam called the MCCQE1, and that means they can now graduate out of medical school and then they can apply for the next steps called residency. Because in Canada, you cannot practice immediately after medical school, which is an option for doctors from many other countries. This MCCQE1 is an MCQ based exam. The whole idea is this exam assesses the medical knowledge and the critical thinking you have developed as a medical student, so eventually you can use this as you transition into residency. This exam consists of 230 multiple choice questions, and they divide them into two sections of 115 questions each. To complete this exam, candidates get 2 hours 40 minutes for each section. There is an optional break in between, and I personally highly recommend do take the break after the first section, because focusing on 115 questions, although it doesn't seem like a lot, it can be a lot because you have put in a lot of thinking. This MCCQE1 examination is a must if you are planning on entering residency in Canada. In addition, you also have to be a permanent resident in Canada or a Canadian citizen to enter into residency program. However, to do this particular exam, you do not have to be a permanent resident of Canada, okay? And this exam can not only be taken in Canada, obviously, but also can be done in many other countries. This is a question we frequently get. You could finish your MCCQE1 and then take the NAC OSCE, or you could even take the NAC OSCE first and then do the MCCQE1. You could do this either as a medical student or after you complete your medical school or medical college. Amongst the various pathways that exist in Canada, there are two pathways where MCCQE1 exam is a must. So one is you entering into residency, and the other is what is called as a practice ready assessment. So in practice ready assessment, you're essentially a specialist in your home country and you apply to practice ready assessment. They do evaluation of your credentials and then they say, okay, fine, you can now practice after meeting certain criteria. And we have personally seen quite a few candidates who have been successful through the practice ready assessment pathway, both in family practice but also as specialist doctors in various provinces. Now, in order to bypass the MCCQE1 examination, you have to think of what your background is. Now, let's say you're trained from one of these countries: Australia, New Zealand, Hong Kong, Singapore, South Africa, Switzerland, and the UK. This could be either as a general practitioner or any specialty for that matter. This is applicable across almost all specialties. Then you can directly approach the Royal College of Canada and follow that path and then bypass your MCCQE1 examinations. Now, there are also other opportunities that Royal College of Canada gives you through which you can establish yourself as a fully licensed doctor in Canada without MCCQE1 examination. Now the question is, what happens if you're not from one of these countries? In this case, what we encourage candidates to do is they explore the option of applying for a clinical fellowship. Now, in order to do this, you must have graduated from a medical school or college that is recognized by World Health Organization. You must have completed your PG or residency in your home country, and you must also have a license to practice that specialty in your home country, ideally. And then you apply for a clinical fellowship through one of these specialties. Once you get successful in any other clinical fellowship, you would use that experience to find job opportunities. And then once you become successful with these jobs, this is when you can actually obtain a full license to practice your specialty in Canada. And this is across all specialties. This is nothing specialty specific. Now, initially, this begins with the license having some restrictions, and then eventually you transition to a full license. This is kind of like the alternate entry path program in the US. In spite of this is a fantastic specialty where you bypass the MCCQE1 examination in Canada, and not only the exam, you also bypass residency in Canada. We personally know of quite a few candidates who have taken this path and are currently now practicing in Canada without any problems. The other good thing, you do not have to be a Canadian permanent resident, nor a Canadian citizen to achieve any of this. If you find a clinical fellowship and a job, the hospital will help you get a visa. Then you will be given a work visa that will allow you to work in Canada. And using this experience, you can then also apply for permanent residency in Canada. In our opinion, this is the quickest way of getting a Canadian permanent residency. And I myself got my Canadian permanent residency through this approach. Of course, I understand this can be pretty complex for many of you. You can always reach out to us on our website www.imgsecrets.com and book an appointment with me or one of our experts, and we will be more than happy to guide you. We also guide physicians, surgeons, and also dental doctors and nurses to establish your career in the USA for nursing. Next, I encourage you watch this video where I've exactly mentioned how this process works, where you can bypass MCCQE1 and initially find a position and then transition to Canada as a fully licensed doctor. Any questions, do post in the comments below. Take care, stay safe, I will talk to you soon. And residency is when you start building that. You can think of this like building a, you can think of this exam like building a high-rise building. Essentially you're training in